Tonight, and 10 years after it was first promised, we still don't have a health care plan from the White House, the Trump White House, that is. We were expecting one yesterday, but the president delayed it because Republicans are pushing back. And so the clock is now ticking with the deadline to extend Obamacare subsidies just 5 weeks away now. And if they're not, millions of Americans could see their costs double. Like last month, Mike Johnson said that his party had a health care plan and it was ready to go. Listen to this.
Is if the government reopened tonight, would Republicans have a plan to address the Obamacare subsidies?
Yes.
You would have a plan
we
tonight.
have proposals to, we could have that ready immediately. Yes.
Well, it has been more than a month since that interview, and still there is no plan. Remember this moment. Late John McCain and his famous thumbs down that killed the Republican replacement to Obamacare, that was 8 years ago. That means Republicans had 8 years to come up with an alternative, and still there's nothing. So after that McCain moment, Trump tweeted that lawmakers should let Obamacare implode, and then they'll be forced to create a new plan. And earlier this month, he posted that Obamacare, quote, sucks. But it turns out that the centerpiece of the Trump plan is to extend the Obamacare subsidies. Well, that's something that Democrats had demanded during the shutdown. However, tonight, if you're following all of this, Trump actually denied that he wants to extend those subsidies. Listen.
I like my plan the best. Don't give any money to the insurance companies. Give it to the people directly. Let them go out and buy their own health care plan.
Plan to extend those subsidies?
I'd rather not. Somebody said I want to extend them for 2 years. I don't want to extend them for 2 years. I'd rather not extend them at all.
Will you do it?
It may be some kind of an extension may be necessary to get something else done because the Unaffordable Care Act has been a disaster.
If it's such a disaster, where is the alternative plan? Where is it?
There is no alternative plan. Donald Trump understands that costs are going up and that Americans are frustrated with this administration and Republicans. And now costs are about to go up again when it comes to health care. And so I think what happened here, and I would love to hear Scott's thoughts on this, but it sounds like Donald Trump for the first time is actually hearing the American people, wanted to do something about it and potentially extend the ACA subsidies. But it sounds like Speaker Johnson was like, this is not going to go well in the Republican Party. This should not move forward.
Speaker,
and so now,
so Speaker Johnson,
seeing
to your point, look, he argued during the shutdown, we're going to deal with it after. We're going to deal with it after. Now he's cautioning the White House, according to the Wall Street Journal, that most Republicans don't have an appetite to extend those subsidies, according to people familiar with it. It is a demonstration of, I don't know if it's actually a political difficulty or maybe a political lack of will on the part of Republicans?
Well, look, a couple things. Number one, just to answer your question earlier, we live under a Democrat healthcare regime called Obamacare. It's not a Republican healthcare plan. It was a Democrat president who put this on the American people, and we're now living with that. Plus, we're living with the cliff and the sunset they put in and the subsidies that we had to put in, I guess, to pay for the disaster that was Obamacare. All done by Democrats, not done by Republicans. To answer your question, there's a very simple answer to this question. The president has raised, and I think most people would agree, that why are we giving billions upon billions upon billions of dollars to health insurance companies when nobody feels like their insurance is getting any better, their benefits aren't getting any better? You've got millions of people whose insurance is so bad they never even try to use it. It has failed. He has simply raised the point. Why don't we just give people money directly so they can go to the doctor and feel like they can get treated without dealing with some friggin' insurance company that doesn't really allow them to use their benefits anyway? That's the president's plan. Now,
that's actually not the president's.
It is. It's literally what he said out loud.
It's not entirely the president's plan. Here are the other details. They do plan to extend the Obamacare subsidies, at least according to what they were going to release this week. They're going to add a new income cap. They would require all new enrollees to make minimum monthly payments, and then they would have that health savings account option. But the health savings account option, that all sounds good and well in a system that we don't have right now, in which those accounts, I don't care how much money is in them, it's not going to be enough to cover someone when they go to the emergency room because they got hit by a car, and then the bill that they get as a result of that is $30,000. So where is the actual health care plan to address the actual health care system that we have in this country?
Well, you're pointing to the Wall Street Journal as if it's the Trump healthcare plan. We don't have a healthcare plan yet.
We should clip
I'm
that.
glad.
We should clip
We
that
don't.
quote.
That's
not
right.
out
We don't
publicly.
have.
Not
We
out
don't
publicly.
have.
I guess that was the question I was asking is why?
I think the president's
Where is the
exactly
plan?
right. So since I left the AG's office over 10 years ago, my family's been working on a cash basis using a Christian co-op, not Obamacare. It is the Unaffordable Care Act, and it works better working with cash. If he'll deliver dollars directly to people, like he just said in the clip you played, instead of insurance companies, then yes, there'll be an adjustment period, but it's going to work a whole lot better for ordinary Americans.
Can I ask you a question? Because I'm not sure how that system that you're talking about works. What happens if there is a serious catastrophic illness in your family? Who pays for that?
That's what co-op backup is for. It actually looks like insurance. We don't get any help until $10,000 or $12,000 worth of cost, something like that.
But how do the working poor?
They're not going to be able to afford that.
How do the working poor?
There are other options with a lower level of catastrophic care. I think that's what insurance is supposed to be. Your car insurance doesn't pay for your oil change.
Car insurance and having a heart attack are vastly different.
Of course it is, Bakari, but you're playing on the emotion.
I'm not.
You're playing on the emotion.
I'm not playing on the emotion. I'm playing on. We have family.
You said we don't have that system, Abby. You know what that system we don't have is? It's called a free market.
But can I just address what you just said?
And it doesn't work.
There is a difference.
And it isn't fixable.
There is a difference between your car breaking down and you needing an oil change and you having a heart attack and needing health care. Because the difference between those two things is a life and death. That's not emotions. That's actual just
I'm talking about
life.
the financial side of what is insurance.
But I do think this is important. What is health care, right? Health care is not just nice to have. It's the difference between life and death for people. And so I think that's part of the issue here. Is a system that you're talking about one in which if you just can't afford it, you're just on your own, you're screwed.
But that's not what it is. That is not what healthcare is.
Bakari, can you just give me just a second for him to answer?
And you want to focus on what healthcare is, and my comment was directed to what is insurance. And we don't have
healthcare
insurance
is in service
for what we call health insurance.
Insurance is in service of providing healthcare. I mean, they're not separable.
Right. I remember back, when Obamacare was rolling around, the Virginia equivalent of the HHS secretary, a doctor, said health insurance is not health care. We see this in the Medicaid system all the time. We have low prices in Medicaid, but we don't have medical providers. So you don't have access to care.
Which I understand that. I mean, obviously there's care, right? And then there is what happens
is the most important thing.
What happens when the unthinkable happens. And that's really what insurance is there for. But look, the bottom line is this is actually an interesting and a good conversation that we're having about what healthcare looks like in this country. That is not the conversation that is being had right now at the level of people who are making decisions about what healthcare should look like. I mean, if there ought to be a new conversation about healthcare, why isn't that happening? Why is the White House just putting out a plan and then Republicans are saying we don't want to do anything about it?
The Affordable Care Act, also known as Obamacare, it mirrors what happened in 2006 with the Heritage Foundation coming out to eliminate the free rider program and create this individual mandate that was pushed forward by Mitt Romney, right? So this is not some Democratic socialist just creation first. By the way, it was pushed forward by the Heritage Foundation. So if Scott and Ken want to disagree with that, that's fine.
And
health, that's fine.
Strongly.
But that's fine. You take that up with the Heritage Foundation. But what I'm also saying is that healthcare is more than that, which is why I was trying to jump in earlier, because people have this really weird just fascination with it's just people who show up in your emergency rooms. We've heard that this whole time. It's more than that. And what Obamacare did, which is what I like to call it, because he deserves credit for it. Whatever you want to say, he deserves credit for it. He did something that nobody else was able to do, but it allowed people to stay on their insurance until they were 26 years old. It got rid of health insurance companies who were literally pushing people out of emergency rooms, not caring for them because they had pre-existing conditions. But healthcare is more than that, and I think Ken would agree with this as well, because in rural communities like you represented in Virginia, like I'm from in South Carolina, it is almost the epicenter of your economy because it props up your rural hospitals. If those hospitals shut down, if you don't expand Medicaid, what happens? Your entire economy closes down because what's around those rural healthcare facilities? Bakeries, little hotels, pharmacies, all of these things. It's your number one employer. So it is a part of most communities in this country, entire ecosystem. And Republicans are so microscopic when it comes to it. So that's why you have people like Nikki Haley when she was governor of South Carolina who didn't expand Medicaid, and now they're looking back at it and it was a faux pas. Or Mississippi, because Republicans fundamentally wanted to tie this to Barack Obama. They didn't want him to have the credit, and now they don't have a fix or a solve for what should be a program that adapts with time.
Right. Next for us, Ben Shapiro takes on his fellow conservatives and then he blames them for making young men feel like they are the victims. Does he have a point? We'll debate.